Welcome and thank you everyone for joining us today. My name is Zed Tintor and I am the Director of Program Development at LGBTIQ Health Australia, previously known as the LGBTI Health Alliance, and my pronouns are she and her, and I'm situated on Gadigal land today. Before we kick off, I'm going to do an acknowledgement of country. So we acknowledge the traditional owners of country in Australia, their diversity, histories and knowledge, and their continuing connections to land and community. We pay our respects to all Australian Indigenous peoples and their cultures, and to elders of past, present and future generations. We acknowledge that sovereignty has never been ceded, and it always was and always will be Aboriginal land. We're really excited to have so many people join us today. So if people could, in terms of identifying yourselves, if you could just share your name in the chat box and the land that you're situated in. And I guess, you know, one of the things that is important to LGBTI Health Australia, known as LGBTIQ, is to, you know, source opportunities to collaborate with our partners. And so we're really thrilled to host the launch of the LGBTIQ+ Suicide Postvention Response Plan. We believe that this report is vital to the future health and wellbeing of our communities, and we sincerely thank Switchboard for their leadership in this space. How this webinar will be presented is that Joe, the CEO of Switchboard, and Anna Bernasocci, Suicide Prevention Manager, will do a presentation for 40 minutes. Then after that, after the presentation, we've allocated 20 minutes for questions. But to support a more streamlined process, we thought that during question time, that if you could submit your questions into the chat function throughout the presentation, and so that way we can look at them and be more prepared for questions after the presentation. So I will now hand over to Joe and Anna for the presentation.
Thanks, Ed, and thanks for opening today's meeting. So as Ed said, well, my name is Jo Ball and I'm the CEO of Switchboard Victoria, which is an LGBTIQA+ community-controlled organisation based in Melbourne, Victoria, and provides services throughout the state of Victoria. Today, I'm joined by Anna Bernasocci, who is the Switchboard Suicide Prevention Manager, and probably is doing the most heavy lifting in this conversation. However, I'm going to say some introductory statements. For those who don't know me, my pronouns are they and them, and I proudly identify as transgender non-binary. So, I mean, I too would like to acknowledge the traditional owners on whose land we meet today. I mean, we're all on Aboriginal land if you're listening to this in Australia, but I'm on the lands of the Wurundjeri people of the Kulin Nation, and I'd like to pay my respects to their elders, past, present, and emerging. And I want to acknowledge all the Aboriginal and/or Torres Strait Islander people that are joining us today in this webinar, and pay respects to your elders, past, present, and emerging. One of the things that's really important as an LGBTIQA+ organisation is that we need to recognise that LGBTIQA+ people existed before colonisation in this country, and there is language that predates and understandings and cultural understandings that predate colonisation. And one thing is to remember the different languages of our community, and one thing is that for the trans Aboriginal and/or Torres Strait Islander people, the language is brother boys and sister girls. And I think that's really important. So I also want to acknowledge, look, we're talking about suicide today. And when we're talking about suicide and we're talking about an acknowledgement of country, we have to acknowledge the devastating rate of Aboriginal suicide in this country that is driven by colonisation. So I want to acknowledge that for all Aboriginal people who are listening and for all of us who are in this meeting. And I also want to recognise the intersection of being LGBTIQA+ and Aboriginal and how that is overrepresented in suicide statistics as well. And we all need to be working together to address racism in this country if we're going to address those overrepresentation of suicide. So I'm just going to start with setting up a little bit of, if you like, setting up a bit of safety in the room, because I think it's important that we have a bit of a warm up, I guess, to the content of suicide. I mean, some of you who are joining us today, you might all the time hear the word suicide because you work in suicide prevention. Although I want to recognise that for a lot of people, even just hearing the word is extremely triggering, might make you jump or uncomfortable. So I'm just going to say that today we're going to be talking about suicide, and I'll be using that word over and over again, and so will Anna. We will be talking about LGBTIQA plus suicide, and we'll be talking about grassroots responses and community-led responses to LGBTIQA plus suicide. Although we're talking about suicide, I'm going to talk about it safely. So what you can expect from me is that I won't be talking about the details of any person's death, including how, where, and what. And I'll be following the mind frame principles of talking about suicide safely. So I won't be talking about method, means, and location, or how, where, and what. And we ask the same thing of you in the chat function, that you equally follow that, that protocol. Of course, saying that, it is really important to talk about suicide and to combat the stigma. And sometimes I think we confuse the question of not talking about methods, means, with that we shouldn't talk about it at all. And at Switchboard, we really believe that we must talk about it if we're going to combat it. However, if you do need to talk to someone, if you've been personally affected by suicide yourself, it is important that you do find a space to talk to people about it. And you probably, I would suggest you do need to talk about the details of that suicide, but this is not the forum to do it, to tell personal stories about yourself or other people in the detail of suicide, the methods, means. If you do need to talk to someone about suicide, including your own personal experience, you can call our staff on the Rainbow Door if you live in Victoria, and we'll have those, we can share those details with you. If you live in Victoria and anywhere else in Australia, you can call Q Life, and we'll be sure to share both of those details at the end. So all Rainbow Door staff, if you live in Victoria, are trained to respond to suicidality and suicide bereavement. So Rainbow Door and Q Life are both LGBTIQA plus helplines. Before I go on any further, I do want to acknowledge the role that lived experience plays in our work at Switchboard, and more generally, the important role that survivors play in preventing and responding to suicide. Survivors, that word in the suicide prevention community, includes those who have lost someone close to them to suicide, or someone who has personally made an attempt on their life and survived. Through the stories of survivors, we learn what our communities need and what we can do better as a society to work towards a world beyond suicide. And the stories and contributions of LGBTIQA plus survivors play an important role in demonstrating what we need to do differently when LGBTIQA plus lives are in crisis. If you personally are a survivor, I want to welcome you to this space today. Some of you know about how at Switchboard, if you followed the Switchboard journey or read articles around our journey, you would know that at Switchboard, our staff member in 2018 died by suicide. She was our volunteer coordinator, and her name was Ingrid Zhang. We do this work in suicide prevention, in postvention, in bereavement, in her name, but we also do it in the name of all LGBTIQA plus people who have died through suicide. If you have come here as a survivor today, welcome again. And I want to acknowledge the lifelong journey you are on, and to acknowledge that I'm here with you on that journey as someone who has a lived experience of being bereaved by suicide. To any first responders who might be with us today, police or acute mental health workers or any other type of first responder, I want to acknowledge the role you play in responding to suicide and the personal cost it has on your life and families. And thanks for being here. Finally, I want to thank everyone who has come to learn more. This is an issue that is extremely close to my heart, and I assume the fact that you are here means that obviously it is close to all of your hearts. So, what can you expect from us today? What are we going to do? What are we going to do today together? Today, we're going to officially launch our LGBTIQA+ suicide prevention response plan. I'm now going to do a brief introduction to the report, and this will be followed by Anna doing a more detailed introduction to the report. I think it's really important. Obviously, I think that it's really important, the lived experience. So I want to take a moment to dedicate this launch today to the lives of 3 people, LGBTIQA+ people who have died by suicide. I would like to dedicate the launch of this report to the lives of Ingrid, Mitch, and Bridget. We say your name, we remember you, and we fight for a better future in your name. Thank you to the LGBTIQA+, thank you to the LGBTIQ Health Australia for hosting our launch. We are proudly members of LHA, and we're also the Victorian partners in the National Service of Q Life that we do in partnership with LHA, with 2010, Diverse Voices and Living Proud. The research into this response plan was funded by the Northwestern Melbourne Primary Health Network and the Pride Foundation Australia. We thank both of these organisations for their ongoing courage to fund this courageous research and their ongoing support. I want to acknowledge and thank the Research Oversight Committee. Without them, this work would have been impossible. And that is Associate Professor Ruth McNair, Professor Catherine Johnson, and Professor Myth Maple. You 3, as I said, have made this work possible. Thank you to all the people with a lived experience, people who were interviewed and contributed to the findings within this report, and who were interviewed for this report, and some who are still being interviewed for this report. Although today is our official launch, I want to let you know, in true Switchboard style, we did actually unofficially release this report in December last year. We planned to release the report now, but we released it early at the time because we wanted to help LGBTIQA+ communities who were responding then and there to an LGBTIQA+ suicide, actually a number of suicides in our community. We went early with the report release because our communities needed it. We recognised that people needed it then and it was ready to go. And after all, this report is actually fundamentally about helping people, and it's about being useful. It's about us at Switchboard being useful to our community. In December last year, it was needed, so we released it. But today, it is the official launch, and that's equally as important. So integral to this report is telling the story of how we as Switchboard Victoria responded after an LGBTI suicide in our Switchboard community. Our stories of bereavement and loss are braided into this report and coupled with evidence-based research from the sector. Importantly, this report is the lessons we learnt from the difficult time, a time that we all still very much are in. We still are in a postvention stage at Switchboard. And our greatest hope with this report is that it will help people and it will continue to help people, and that the people who come after us in needing to respond to an LGBTIQ+ suicide can find the path at one of the worst times in your life a little easier to walk along. We want you to know that we're in the middle of this work. So in many ways, this is an interim report, but it is also useful for people today. The full report will be out soon, and we encourage you to stay with us on this journey and join us again when we release the full report in June. As we continue to make sense of our collective grief at Switchboard through action, activism and response around LGBTI suicide, this report is part of that action, and the other part is the ongoing work we are doing in our dedicated LGBTIQA+ suicide prevention program led by Anna Bernasocki. At Switchboard, we strongly believe that we honour a person's life, not with a moment of silence, but a lifetime of action. And with that, I'll hand over to Anna.
Thank you, Jo, and thank you, Zed. Today, I'm going to talk you through our journey at Switchboard as a LGBTIQA+ suicide prevention organisation, the research process, and the various stages of developing the LGBTIQA+ suicide postvention response plan preliminary findings. As Jo mentioned, in 2018, Ingrid was working at Switchboard as the volunteer coordinator for the Q Life services operating in Victoria. When Ingrid died by suicide, Switchboard as an organisation and our broader community was absolutely devastated by her loss. At Switchboard in suicide prevention, we locate ourselves in our work through our lived experience. So for me, part of my lived experience is that I knew Ingrid in my capacity as a Q Life volunteer. At the time Ingrid suicided, I was someone who regularly took calls on the Q Life service, and Ingrid was someone who I looked up to and felt connected with through our shared passion for the work that Switchboard did. Although I was not someone who was intimately close with Ingrid, like her friends, chosen family, colleagues, I felt her loss very deeply. And as part of the broader Switchboard community, I was not alone in my experience. After Ingrid died, many people felt impacted by her death. Staff, board members, volunteers across the programs, even others who were engaged with Switchboard at partner organisations. The ripples of her loss were very far-reaching. And I believe today we don't know the full extent of just how far-reaching that impact was. So in response to this widespread impact, Jo and senior leaders at Switchboard took on the responsibility of devising and implementing a plan of how to provide support to anyone who had been affected. This is the original postvention plan that came before the report that we are releasing today. The support needing to be provided was more than individual counselling. It needed to address the social and community impact that Ingrid's death had had. It also needed to help us as an organisation at Switchboard navigate the crisis and over time move beyond crisis response into legacy. Like Jo said, our suicide prevention work at Switchboard is part of that legacy. Thanks, Jo.
I think you can. Oh, you want me to change the slide? I thought you were saying now it's time for you to talk. So no, it's certainly your turn. Here we go.
Thanks, Jo. So today we're launching our LGBTIQA+ postvention report. This report reflects on those postvention activities that Switchboard implemented through the original postvention plan, and it offers guidance to anyone who finds themselves in a position where they're enacting a postvention response. And something that we've learned through this experience is that you don't know that you're going to be responsible for implementing a postvention response. And that's part of why this work is so incredibly vital. I'm also very aware that as someone who works in LGBTIQA+ suicide prevention, that the word postvention can roll off my tongue, but it isn't necessarily a word that many people know until after a suicide has happened and they've become affected. So when we talk about postvention, we're referring to the implementation of strategies and supports to people bereaved by or exposed to a suicide death, which help to facilitate bereavement, reduce the likelihood of further suicide distress or deaths, and help to restore resilience in a community affected by suicide. So postvention has a dual purpose. It helps to facilitate bereavement and also to decrease the risk of that heightened suicidality and further suicide death among people who've been affected that can happen. In our communities, responding to suicide death is not uncommon. However, until we produced this report, there were no resources available that demonstrated and explored how postvention can be tailored for LGBTIQA+ communities. And sadly, this is something that we know firsthand because in 2018, when Jo and senior leadership team at Switchboard designed the original postvention response plan, they were unable to find any mention of LGBTIQA+ people in readily available postvention resources. The resources didn't speak to the many of the challenges that Switchboard was facing, such as engaging with both chosen family and biological or family of origin, running queer ceremonies, and how to respond to that widespread effect across the small community. So in lieu of this guidance, the original postvention plan drew from queer histories. It particularly turned toward the practices around grief that emerged during the AIDS and HIV crisis, when predominantly gay and bisexual men were dying. It was common during this time for queer people to grieve together, to hold ceremonies and tributes that recognised and celebrated the lives and queerness of gay and bisexual men. I'm sure for some people in the audience today, you've recently watched the series that's been on Stan, It's a Sin. For me, watching this show showed me firsthand what those ceremonies were, how it was that queer communities came together following death to mourn and to grieve and to celebrate queerness and gayness, which is what Joe and the leadership team at Switchboard knew was going to be important following Ingrid's death. During that time of postvention, Switchboard did some really great things. And many of the Switchboard activities that were run and the sustained postvention efforts were really helpful. There were also things that Switchboard learnt through the experience, which is how we've come to do this research, is that we wanted to build on those learnings and to begin developing an evidence-based demonstrating ways to support communities that are affected when an LGBTIQA+ suicide happens. Thanks, Joe. So I've been leading the research project, which began in 2019 when I moved from my role as a volunteer at Switchboard into a paid capacity as the suicide prevention manager. For the first 5 months of the role, I met with people across the Switchboard community who've been impacted by Ingrid's death and began building relationships. It was really important to do this. I needed to understand more about the context and the experiences that we would be looking at in the research that we wanted to capture. I needed to have a thorough understanding of who, how, when, and where, so that I knew who to approach as participants in the study and could just design interview questions that were directly about the postventions that Switchboard implemented. I also worked with a lived experience co-design. I also worked through a lived experience co-design approach. In our research, the lived experience of those from our Switchboard community has been the foreground from the very beginning. To date, I have worked with 6 different LGBTIQA+ people who have generously shared from their experiences and helped to shape the research. It was incredibly important to do this. Our work has to come from a place of compassion and care, and this approach has helped ensure that the research is sensitive and accurate. It also helped me through the research process where, as the researcher, I was constantly negotiating what is going to be harmful and what is going to be helpful. Another positive of this approach is that through lived experience co-design, you empower people through their involvement. And especially following bereavement, where for some people, being able to be involved in suicide prevention activities can foster healing. Additionally, I worked with an oversight committee of 3 academics who were able to help me put the research through an ethics process, as well as being able to turn to them for advice and knowledge and input at key stages of the research. For the research itself, we identified 2 objectives. Firstly, we wanted to continue the recovery of the Switchboard community and deepen understanding surrounding the traumatic experience. And secondly, we wanted to reflect on postvention strategies and use these insights to develop an LGBTIQA+ suicide postvention response plan. To collect the data from the research, we chose a methodology using semi-structured qualitative interviews to give participants the space to reflect openly on their experiences, yet give some direction to help ensure that the research questions would be answered. Thanks, Joe. In the preliminary report, we have used thematic analysis to identify 4 key research findings. Firstly, LGBTIQA+ relationality and loss through suicide. This is about how LGBTIQA+ people may relate to one another and how that might be involved in the impact of suicide. Secondly, LGBTIQA+ experiences of suicide bereavement and grief. So this is how it might be helpful, or how it might be that LGBTIQA+ people experience grief following LGBTIQA+ suicide. Thirdly, facilitating LGBTIQA+ bereavement and grief. This is the expression of that grief. How can we help people to connect with those feelings? What is it to experience queer grief? And lastly, LGBTIQA+ suicide and peer connections. Here we look at the importance of having a peer-led response when LGBTIQA+ suicide happens. I don't have time in today's webinar to explore these key findings in great depth, so I invite you to go to the words of the participants themselves who are quoted in the report, as it is their words and their experiences which explore these findings best. Thanks, Jo. I have taken a quote from the report, which for me describes the overarching concept which has emerged from the research and to which we'll be continuing to explore in our work. In the report, we write that LGBTIQA+ postvention is a concept which arises from an understanding of relational identity between LGBTIQA+ peers. It recognises that LGBTIQA+ people are connected to LGBTIQA+ peers, community, culture, and history. This is the new concept. This is LGBTIQA+ postvention in 2 sentences. We have articulated something that happened at Switchboard. It's what we experienced, and it's what we see when there is a suicide of an LGBTIQA+ connection. It captures the grief and loss that is experienced and how it is inextricable with or relating to identifying as LGBTIQA+. You can't separate the two. Our participants expressed that they valued and in fact they needed to be supported through postvention to connect positively with expressions of LGBTIQA+ identity, that they needed to connect with LGBTIQA+ cultures and supportive LGBTIQA+ communities. So for example, following Ingrid's death, Switchboard ran a community memorial in which Ingrid's LGBTIQA+ kin celebrated her queer life. Participants overwhelmingly found this to be a positive experience, which offered connection, recognition, comfort, and validation. There was a space where their grief was validated and where they could grieve with other LGBTIQA+ people who were going through something similar. It is this that we argue that creating opportunities for LGBTIQA+ people to connect with identity, with LGBTIQA+ peers, community, culture, and history that strengthens the protective factors for LGBTIQA+ mental health and well-being. And it is this in turn that is likely to prevent against further increase in suicidality and suicide death among LGBTIQA+ people who have been affected by suicide. So importantly, when we're talking about LGBTIQA+ postvention, we're doing 2 things. We're facilitating the bereavement of people who've been affected by suicide, and we're also making sure that we respond to others who have become affected by the suicide through exposure or perhaps through a less personal connection. We want to be validating that grief. And when we provide opportunities for people to grieve in validating spaces, like queer communities, that is when we bolster the protective factors that protect against suicidality and suicide death among survivors. Next slide, thanks, Jo. Like Jo mentioned, these are only our preliminary findings. So as part of the National Suicide Prevention Trials, we began running this project in 2019, and at the time that COVID-19 had its onset in Australia in March last year, we were in the middle of data collection. We had to pause data collection. Through our original ethics application, we were planning to conduct all interviews face-to-face, which was then unable to happen. We have since attained a variation of our ethics in December last year and can now recommence the interviews with participants over Zoom or face-to-face. And we're hoping to finish data collection by the end of April and complete the final report by the end of June. The final report will have further analysis of the qualitative data and explore different themes to those that are captured in this report. I don't know if there are any researchers in the audience, but if you are a qualitative researcher, you will know that you come away with so much information, and it's always it's always a bit of a painful process trying to pick parts to distill and speak to, because there's so much more that you want to say. So hopefully in this final report, we will have even more information for you that can be really useful to those who are implementing postvention, as well as providing bereavement support. Thanks, Jo.
Thanks, Anna. And I just was going to spend a bit, before we go to open questions, and we certainly want to allow enough time for open questions, I just wanted to go through a bit of what we're doing at Switchboard that are other resources that are worth knowing about and connecting you with if you haven't had a chance to do it, to see go to our suicide prevention page on our website yet. I encourage you to do it, and that links to some of these sources. But I just want to go through a few things. And so the first one is I want to talk to you about the podcast, which is called Let's Talk About Suicide. That is a 14-week podcast where I'm part of it. It's produced with Joy and in partnership with Jesuit Social Services Support After Suicide. And we interview, there's a range of voices of lived experience in it, of people talking about what it was like to lose someone to suicide. And the producer, Hamish Blanc, he is a man who lives with a lived experience of suicide. I have a lived experience, as I explained earlier, and Louise Hay, the other person on the panel, works in that every day. So I really recommend it. What we've heard from people is that this podcast is, if you have just recently lost someone to suicide, and recently, I mean in the last 5 years, I would consider that definitely recently, or even longer, is that this is a great podcast to listen to, and people have told us they've gotten a lot out of it. And basically when we made this podcast, we made the podcast that a number of us went looking for after the suicide. We went looking for voices of people talking about what we were going through. And so the lived experience voices are a mix. Some people are partners of people who have died, and other people are chosen family. Look, it's not easygoing content, but what we do know is that people who are experiencing this get a lot out of hearing the voices of others. And it covers such topics as memorialising, what does the 1 year anniversary look like, preparing for the 1 year anniversary, what does the first 48 hours look like? So it sort of steps through. So you can listen to it as a series, or I've heard of a number of people, they've just listened to the episode that's relevant to them. It may not be relevant to go back and listen to the first 48 hours, but it could be for people who are feeling, it could be for other people. So I encourage you, and I also encourage you to share this podcast as a resource. And we're proud to say it was nominated for the Australian Podcast Awards last year. So there's that. And currently at the moment, we're working on bereavement groups with Support After Suicide to set up LGBTIQA plus peer-based bereavement groups. And we're working on that with hoping for some of them to start this year, COVID willing, of course, and our ability to meet in person. At the moment, those bereavement groups are based in Victoria, and because of our service nature, but we are looking open-minded to the idea of online groups. Particularly COVID's changed that for so many of us to think more laterally. The other thing I want to draw people's attention to is assist. So if you haven't done the Applied Suicide Intervention Skills Training and you're interested in working in suicide prevention or responding to suicides in your community, I would suggest you do assist. There is currently a model out that a number of services throughout Australia run an LGBTIQA plus version of assist. So you might have done a standard assist training, but there is actually an LGBTIQA plus version that was recently developed. So I know that some local, like 2010 is a service in New South Wales that runs assist. I believe there are people, I know there are people in Brisbane and other states. So we encourage you to find your local provider of assist. In Victoria, we have assist trainers. Thorn Harbour Health has assist trainers. Drummond Street Services has some assist trainers too. So I encourage you to consider that as an option. It's a 2-day training course, and there's also Safe Talk, which is another version of it. That's it. The Other thing I wanted to draw your attention to is in September last year, Switchboard started our statewide telephone service Rainbow Door. And one of the reasons we started Rainbow Door was to provide a more intensive case management service helpline. So we have been a partner, we've been running a telephone service for 30 years, and in 2014 we joined the national partnership of Q Life. And Rainbow Door is our second phone line, and it's a service that provides a more intensive support. So it has a callback service, and it was in recognition of a reflection of what is needed around suicide, is that single sessional support is really important, like the Lifeline model, like the Q Life model, where you call up and you speak to the person who answers the phone. But we recognise there is a need sometimes for people to have a more intensive helpline response. And that was in our thinking when we set up the Rainbow Door. And in Victoria, it is a statewide Victorian service. It doesn't work nationally, although, state borders. We obviously take phone calls if people do call us, but it is set up and funded by the Victorian government. Is that when you ring up and we would seek to set up safety with you in the space if you were living with suicidal distress or supporting someone in suicide distress. And then there's the option that we could call you back in the next days and weeks that follow before we refer you into service. And we've recognised around suicide that is needed. So that's the Rainbow Door. That has its own website. You can see that, www.rainbowdoor.org.au, and you can find out more about that service there. There's the podcast, it's Assist. We're setting up the bereavement groups. And that's our program as it stands and the work that we are doing, more work to come. And where to from here, I guess, is the final comment. I just say, stay connected with us, come back and see us when we do the launch. Hopefully LHA will have us back to do the launch of the full report. Stay connected to us. If you go to our website, we have a suicide prevention newsletter that you can sign up for, and that will keep you informed of the materials and resources that we're releasing. And I'll just leave it now for questions. And I just end again reminding this is a picture of Ingrid, and we remember her. So I'll might take us back to sit on the beginning page.
Lovely, thank you, Jo. When Jo was talking about the Assist training fee from 2010 put up in the chat, you can see there that 2010 has some Assist and Safe Talk dates in Sydney coming up for LGBTIQ folks, and there's a website there that you can go to if you're interested in attending that training. So what we'll do is we'll take some questions now, and if you could put your questions in the chat, that would be great. And Jo and Anna will answer those questions. Any questions people might have? I know it's a fair bit of information to take in.
Just while we're waiting for questions, Renee from Living Works is also, which is the organisation that holds the intellectual property of Assist and does heaps of work of promoting and training people in Assist, in the model of Assist. And Renee's put a link in there of where you can find the full list of people who are trained in it in Victoria. And I'm sure she could help you find someone locally, nationally. So, I mean, I only sort of called out a couple of people that I knew that have been trained, but there is a lot of Assist trainers nationally. So,
and there's some questions here. Is LGBTIQ Safe Talk or Assist available in Tasmania? As far as I'm aware, it is, but I would need to do some research on that. Jo, are you aware of it at all?
I don't know. I don't believe that Tasmanian people attended the LGBTIQA+ training that Living Works did in Assist. but I don't want to speculate about that because also people move around, don't they? And and people have moved more than ever. So I just, maybe there's people in Tasmania.
And we have a question here now. Are there any particular postvention considerations when working in rural LGBTIQ plus communities? Jo or Wenna?
Thanks, Lachlan. I think that's a really interesting question. And for me, when I read it, I come back to what's central in providing postvention, which is around making sure that you're doing a few key things. And that is providing ways in which people can connect with their grief. And the other thing is making sure that you're responding to community in a way that's safe. So what I haven't spoken about today, because I wanted to predominantly focus on queer connection, is around sort of the collection of things that you can do around suicide safety and how you communicate around a suicide. I'm imagining that in rural and regional communities that perhaps privacy is a really big concern, because often you're working with smaller communities, or perhaps you're working with communities that are spread across like a wider area. So, I mean, that's always a really big consideration. But for me, most importantly, it is about providing people with services and providing them with opportunities to be supported in their grief. What I think from our understanding of postvention and its importance is that when people aren't supported during that time, that's when you're going to get probably going to get more intense experiences around suicidality for people who have survived the suicide, as in people who are bereaved. So I guess that's what I would have to say, is approaching it in the same way, following those key principles about providing support, providing people with options, and acknowledging suicide. That's sort of the first principle in postvention. Jo, did you have anything to add?
I mean, I think only what I think most people understand is that there is a higher rate disproportionate to the population of people who die in regional communities. Obviously, there's numerical higher number in cities, but there are drivers in regional areas. And we know that around LGBTIQA plus suicide, that suicide is a response that some people do in our community to escape families of origin and to escape families of origin that are unaccepting and communities that are unaccepting. So when we're thinking about the drivers of LGBTIQA plus suicide, we have to look with a lens of like supportive communities and supportive families is a way to decrease it. So I think it is very important, the work we see in regional communities, whether it's like in Victoria, we've seen a whole sort of, Pride Cups, AFL Pride Cups, but also, a plethora of now regional Pride festivals, not just Mardi Gras and Midsummer and Chill Out, but actually an increase in the level of festivals that happen locally and services regionally being more inclusive. And I think that's really important when we think about how people feel they need to escape their communities. And some people escape by moving to the city, but there is a driver where people escape tragically through suicide. And so I think understanding that is a way to, I guess, understand how important supportive communities are. And how one of the things, I was lucky enough to be involved in the LGBTI Rural Roadshow with the Commissioner, Ro Allen, and one of the experiences I definitely saw on that trip was how many people want to stay in their community. And it's a bit of a myth, I think, that regional Australian queers want to escape the doldrums of the regional community. Actually, a lot of what we saw is a lot of pain of people feeling country people at heart, wanting to be in their local areas. And, I witnessed a number of people who, when the roadshow came, I mean, too many to count really. When I say a number of people, many people, when the roadshow came to town, people used the roadshow, or the commissioner and us being in town, as an opportunity to come back into the town and see if anything had changed, because they were like, oh wow, there's a regional roadshow in my local area, like there's rainbows in the neighborhood house. There's, you know, like people were looking to see, is my community going to accept them? So I think that's, you know, I really can't speak highly enough about regional festivals and the work of regional, like, health centres, neighbourhood houses in smaller communities to do that work. I've seen firsthand how it is, you know, how, you know, adults cry to see that, you know, there's rainbows up in their small regional community for the first time in their life, and a place that they felt very much that they were running away from. So that was a bit off, Lachlan, but I think there's something there, hopefully, that's quite useful about how we think about regional work.
Yep.
I mean, one of the things I'd like, is there any other questions? Because
yes, there is, Joe. Yeah. So, firstly, will the hard copy of the final report be available?
Oh, like, sure. Yeah, I mean, I think, sure, we definitely, everyone wants it. You know, people want hard copies of things still, don't they? I think for us, you know, like, we went digital like everybody else. And we'll have copies available and people will be able to order them, and we'll send them out to you. I guess at the moment, digital's taken the front seat.
Yeah. Okay, we have a few more questions. Adam M has asked, are there any plans to partner with the Black Dog Institute into the future to aid work within suicide prevention?
Well, I mean, I know that the LGBTIQ Health Australia has done partnership with Black Dog.
Yeah, we've started to do some work around that space, and in partnership with Black Dog, definitely. We will actually be presenting some research at the upcoming Health Indifference conference through that partnership with Black Dog. So if you're attending the conference, please check into that session. Okay, Andrew Rogers has asked, I'm curious about what peer-led support programs exist for LGBTIQ folk who live beyond their own attempt to suicide, and how that lived experience is harnessed for suicide prevention.
Firstly, hello, Andrew. I can't see you because of the nature of the webinar, but I know that you're a strong and passionate advocate in this space. And as always, we promise to I look forward to involving you more, you know, in our work, wherever it's possible. You know, I think that this is a really live question, Andrew, and, like, you know, if I get on my soapbox a bit, you know, we actually just don't have, there is an absolute paucity of funding in this country for LGBTIQA plus national responses to suicide. There's a national commissioner, but around us being a priority population, there is not dedicated funding. By and large, the work is done from a mainstream perspective with the large organisations by Black Dog and Beyond Blue. However, and others, by the way, you know, that was just pulling a couple there, Headspace, blah, blah. And but there is the Hope Trials, and I think that's what they're called nationally. They are called and I just don't want to be too Victorian specific here, that doesn't resonate, but in Victoria, we have the Hope Trials, which is support for people after a suicide attempt, a survivor. And at Switchboard, you know, we have an ongoing open conversation with the Victorian government and Beyond Blue about how do you translate, I guess, the Hope Trials to make it relevant for our community. And I think look, if you're in this position and people want to access the Hope Trials, I'm in no way think people should check it out. Like, if you're a survivor, you should look at, and you're looking for more peer-based support, peer being people with a lived experience of suicide, not LGBTIQA plus peer. I recommend looking at the Hope Trials. There's a lot of evidence around their success. However, I think there's a little bit of work to be done to make them as best as they can be to respond to our needs. And we're certainly vigilant in that space to, yeah, I'd leave it there.
Great, thank you, Jo. If people want to have a look in the chat, there's some discussion points around access to assist and online resources. Please check out that discussion. I just want to make sure that we use the time wisely in terms of some of the questions, the direct questions that we have. In what ways can suicide postvention response information, inform future efforts towards prevention? And that question's from Warwick. Would you like me to read that again, Jo?
Yeah.
In what ways can suicide postvention response inform future effort towards prevention?
Jo, I might answer this.
Oh yeah, you go. I can't
okay.
see you, Anna, but yeah, you go for this. This is, and I'll add something if I think.
So postvention is a really important part of the suicide prevention system that we currently have. So when we think about suicide prevention, there are different aspects to it. Often it gets broken down into suicide prevention, intervention, and postvention. And it's really difficult to create a system of suicide prevention that's actually responding to suicidality in our communities without working within each part of this. In postvention, what we know is that people who've been affected by suicide are more likely to experience suicidality or go on to die by suicide. So in that way, postvention is absolutely vital in helping to protect people from those experiences. And that way, it's really important in this whole system of suicide prevention that we're working within. Something else that happens in postvention that's really interesting, and it's certainly our experience at Switchboard, is that it's often through postvention that some of the most, passionate suicide prevention responses form. We've come to suicide prevention through our postvention work, and our suicide prevention efforts in themselves are part of that postvention. So that they go hand in hand. But I think that if we're not investing in each part of this, we're not going to make enough headway in LGBTIQA plus suicide prevention. We need services across and programs and initiatives across prevention, intervention, and postvention.
Yeah, I mean, I think also like we need to always be thinking about what are the drivers. What in drivers is sort of a clinical word in the research around the drivers of suicide. But what drives, which means ultimately what drives someone to suicide. And I think that postvention, there is plenty of evidence to show that people who have known someone who has suicided, that is a risk factor in someone's background that could make it more likely for them to make an attempt at suicide. And I think, so that's, we talk about, that's the reference there. And I think also where, I'll leave it there because I feel like I'm getting a little bit clinical, but I think that what you see in the postvention is you get a bit of a picture, and we certainly have, of like what surrounds people and what's happening in people's lives, and what's happening in the community at large that comes out in postvention. So what was happening around someone's death, both personally and perhaps even socially and politically, that could have all played a role, and the postvention can unpack that, and then you can have a conversation about how do we tackle those system issues in order to make more supportive communities and change policy. Like, I think it's a really, really important, postvention is really, it's bereavement and prevention. That's what it is.
Yeah. Great, thank you, Jo and Anna. So just to share some information, Eilish Davini from the Hope Hospital Outreach Post-Suicidal Engagement Service posted that the Hope program is currently being expanded from 12 to 21 health services, part of the Royal Commission's interim report recommendations. So an important element of the expansion that we do need to know is how that work will, they will work with people at risk of suicide, including LGBTIQ people and Aboriginal people. Important information. Also, we have LGBTIQ Aftercare project through the Northwest Melbourne PHN. It's a pity support model and support for people who have made an attempt of suicide. Unfortunately, though, the program is coming to an end for the trial. However, there is some great evidence-based work that's been gathered to support with future trials. Just having another.
That is just this gold mine. Look at all these awesome people online doing.
Yeah, absolutely. Okay. Hi everyone, I work in Mental Health Reform Victoria office set up to lead the Mental Health Royal Commission and work closely with the suicide prevention team leading the HOPE program at the department. Okay. Any other questions that people might have, because we've only got 2 minutes left. I do want to say that this recording, this webinar will be available. Joe, will it be available on the Switchboard website?
Well, if you're happy, we definitely will link it to it.
Yeah. So
we'll, ours or both of ours, absolutely, we want to share it.
I think we'll have it on the LA website, but also with Switchboard, definitely.
Yeah, I mean, I think the other things, maybe some people here were at some of our earlier talks. We did a talk, Anna and I, about leadership in after a suicide. And I think that's a whole conversation that will come out more in depth in the final report. I think the question of, and when I say leadership, I mean community leadership as well as formal leadership. And I think some of you might have gone to that conversation, but I think that's something I look forward to talking about in the future, is how, because I think what we've seen in over the last year is the complications when there isn't leadership in this space, and how I think a lot of the time, because of the situation of suicide, there's a lot of stepping back and a lot of space, and that leaders or people always step forward. And you know, this resource is for leaders in whatever form that is. So that's, you know, people who work in organisations, and you know, even if you run a small community group or you're running out in Shepparton, as I noticed, Lachlan, I forgot you were from out in Shepparton. And you know, I think that this is I think there's a big question about leadership, and I think I look forward to having that conversation at the report, at the full report. Right. So I think there's still a lot more we want to share with you, and I just really encourage you just to keep on this journey with us as we keep evolving it. And you know, this is a real community grass-led and grassroots run response, and I'm such a believer in that, that yes, we've got the big guys and the big responses, and we need an integrated service system. And I can't wait to see the recommendations of the Mental Health Royal Commission when they're released in Victoria. But I think, you know, we also need this grassroots response, and that's very much our role at Switchboard.
Wonderful. Thank you, Joe. Well, that brings us to an end, and I do want to thank everybody for attending today. It's been a wonderful turnout, and really positive to see, you know, individuals and organisations really keen to receive information about this work. Important work, and congratulations once again to Joe and Anna from Switchboard for taking the lead on this work. If people have any questions after this session, you'll see on the slide there Joe and Anna's emails, and I'm sure that they would be more than happy if you made contact with them. Lovely. Thank you. Joe and Anna, do you want to stay on the line for a moment?
Always. Yeah, thanks everybody for coming. And thanks, I noticed a couple of people sent us some direct messages saying, so I did read them, and thanks for all your kind words. And I should have said this earlier because people are leaving the room, but I must say, congratulations to Anna Bernasocki. Like, she is the lead researcher on this work, and the manager, the senior manager of suicide prevention at Switchboard, and certainly needs their own congratulations for this work.
Thanks, Jo.
Lovely. Good afternoon. Bye-bye.